Hello everyone, this is Dr. Jinisha, Specialist Obstetrics and Gynecology from Abeer Medical Center, Sharafiyah. Today I am going to discuss about gestational diabetes mellitus in a simple manner. What is gestational diabetes mellitus? It is the diabetes occurring for the first time in women during her pregnancy. It usually affects 5 to 10% of all pregnancies and occurs after 22 to 24 weeks of gestation. How did this happen? During pregnancy, placenta releases certain hormones which will act on insulin and make it unavailable. This leads to a situation called insulin resistance, where insulin cannot act and the blood glucose level rises. What are the risk factors of gestational diabetes mellitus? Age more than 30, obesity, ethnicity like Afro-American, Asian, previous history of gestational diabetes mellitus, previous macrosomic baby, family history of diabetes. How can we diagnose gestational diabetes mellitus? During pregnancy, at 24 to 28 weeks of gestation, women can undergo a screening test called glucose challenge test. If the value is more than 140 mg per deciliter at 1 hour, female is subjected to further oral glucose tolerance test, where blood is collected in the fasting stage 1, 2 and 3 hours post glucose administration. If the values are more than the normal prescribed range, then she is diagnosed to have gestational diabetes mellitus. What are the effects of gestational diabetes mellitus? Women can go in for preterm labor, can have premature contractions, recurrent vaginal and urinary tract infection, more bleeding during delivery. Women can have big baby at birth, fetal distress, obesity later in life and delayed mental development. All these complications of gestational diabetes mellitus can be prevented by maintaining adequate blood glucose level. There are 3 ways to maintain adequate blood glucose level: diet, exercise and medication. Diet is the best way to treat gestational diabetes mellitus. If we follow a good diet plan, 85% of the women will be able to attain an adequate blood glucose level. This consists of 2000 calories divided into 3 major meals with small snacks in between. We should avoid simple carbohydrates like sugar, honey, cookies and soda. American Diabetic Association recommends 30 minutes of walking at least 5 times a week. With diet and exercise, 85% of the women will be able to control their blood glucose level. Rest 15% may require medication, which is in the form of insulin. Insulin is completely safe in pregnancy. It will not affect baby. It is administered as injection form. It's always advisable to maintain your blood glucose level less than 95 mg per deciliter in the fasting stage and less than 120 mg per deciliter 2 hour postprandial stage. After delivery, 95% of the cases blood glucose level returns to normal, so insulin may be stopped. Hence, it's always advisable to have a good preconceptional counseling from your healthcare worker, which will lead to a safe pregnancy and delivery with less complications. Thank you.
25 years of compassionate care.
Abeer Medical Group.